I'm Julie Barkey with this Senate update. Should a person with a terminal diagnosis be granted the right to try? Senator Branden Petersen has legislation that he says would allow those who meet a certain threshold to use medical treatments and devices that are not approved by the FDA. He says this is a growing issue nationally, and he hopes it becomes law in Minnesota.
So the Right to Try Act basically, in short, gives people who have a terminal diagnosis an option to access potentially life-saving treatments that haven't made it through the full FDA approval process, so long as, again, they meet the terminal diagnosis requirement as well as they have a prescription from their physician.
There have been some critics nationally who have already stated that, first of all, this undermines the FDA's authority. Do you believe this is a valid argument?
Well, it's not. In fact, the FDA already has a compassionate use exception. It's just that it's so centralized and bureaucratized. Quite frankly, it only serves about 1,000 people a year. So the FDA has already acknowledged that their process is too long to save some people's lives. It's just that they don't have the ability to process, quite honestly, the millions of people who potentially could take advantage of this with terminal diagnoses. 1,000 people a year is a small fraction of the affected patients. So.
I'd like to get your thoughts on this too. Sasha Haverfield, she's the Vice President for Scientific and Regulatory Affairs at Pharmaceutical Research and Manufacturers of America. She states, legislation at the state level, however well-intentioned, is unlikely to add any meaningful new approaches that can optimize the federal expanded access process overseen by the FDA. What do you think of that statement? Well, that essentially state law wouldn't impact this.
Well, it's just not true. Again, that we know that program, the Compassionate Use program, only serves 1,000 people. We have, just in cancer alone, we have millions of people in this country who have terminal diagnosis that can't and will never get through that FDA exception, and so it's just not true. It remains to be seen exactly how that's going to work out, because the latest state to pass it was in late last year, mid last year, and we haven't actually seen it be implemented anywhere. But the FDA Compassionate Use program simply will not serve the interests of most people.
Another concern is pay. Who would pay for the device, the treatment, whatever it is these patients need?
The patients. We don't require anybody to do really anything. Everybody can voluntarily participate. The pharmaceuticals, the physicians, and the patients all have to agree, and the patients have to finance the treatment.
What are your thoughts about all of the criticism and the concerns? It seems like something that should be a no-brainer to some people.
Well, in Minnesota, it's important to point out that MMA right now is neutral. The Pharmaceutical Association in Minnesota is neutral. So as far as the stakeholders here go, everybody has expressed a neutral position. I would also remind everybody that this is passed in 5 states. It's moving through 24 legislatures right now with overwhelming support, and every governor has supported it. And in Arizona, it passed on referendum in an overwhelming manner. So I think we can get it done.
That was my last question. You optimistic this can be done this session?
I do, yeah, I am. I think we've got great bipartisan support. If you look at the bill, we've got the chair of the Senate Health Policy Committee, Senator Sharon, and in the House, Representative Zerwas has a number of Democrat authors. I think we can get it done. I haven't met yet with the Dayton administration, so that'll be the next thing to check off the list. So.
You obviously knew my last question, so thanks, Senator Petersen. We appreciate your time.
Thanks for having me. Appreciate it.